This year, 2019, we're celebrating two exciting milestones: the 50th anniversary of UNFPA and the 25th anniversary of the International Conference on Population and Development, the ICPD. The ICPD was a global agreement that in 1994 put people at the center of the development discourse. 179 countries from across the world, including Rwanda, endorsed the ICPD, and it remains the foundation of UNFPA programs worldwide. And as we celebrate the ICPD this year, we celebrate progress in Rwanda. Rwanda continues to lead the continent in many ways, especially in advancing women's health and rights, with particular progress in family planning.
Suzana n'umukobwa we Maria.
Nitwa Suzana, umugore usanzwe mu cyaro. Navutse ndi imfura mu muryango w'abana 5. Umugabo umwe twari duturanye yigeze gukwe na data ngo ntacyo amaze kuko atabyaye umuhungu uzamuzungura. Umuhungu yaje kuvuka mfite imyaka 11. Ishuri nakundaga imibare, uburyo nta kibazo na kimwe cyananiraga gusubiza. Nyamara data akavuga ati, ubwo tumaze kubyara umuhungu ugomba kuguma mu rugo ukita kuri musaza wawe. Nanjye ni oya data, ndashaka kujya kwiga, reka ndangiza amashuri yanjye. Nawe akavuga ati, nta mafaranga dufite yo guta ku bakobwa.
Umwana w'umukobwa iyo avuye mu ishuri kenshi abataye imibereho ye, basanga ubuzima bwe burangiritse. Gutwita iyo atwaye inda akiri umwana avuye mu ishuri, bwa buzima bwe buba bupfuye, avenire ye yose yabuzagemo. Akenshi noneho iyo umubyeyi atabyishimiye akamubwira nabi, urumva wahura n'ihungabana rirenze.
Nyuma gato y'aho mboneye imihango ya mbere, data ambwira ko yamboneye umugabo. Ese uwo ni nde data?
Tegereza, uzamubona ku munsi w'ubukwe. Se ndamuzi neza, yampaye n'inka. Uranyumva?
Data yambaye agakenyero, yageze amawe n'igendere. Basaza banjye w'amagakoni, barumuna banjye bamperekeza iwe. Rwanda rugiye.
Kuva mu gitondo kugera nimugoroba nabaga ndi mu mirimo: guhinga, gutekera umugabo, kumesa n'akandi kazi ko mu rugo. Hanyuma naratwise nza kubyarira mu rugo ndi kumwe na mabukwe, ariko mfite ubwoba. Nababaye ijoro n'umunsi, ntekereza ndetse ko nshobora gupfa. Nari nzi ko abagore bamwe bapfuye. Iryo joro nibwo numvishe igihunyira mu giti, bamasenge baza basakuza. Nabashije kurokoka, ariko umwana wa mbere arapfa. Nasazwe n'agahinda no kwiheba.
Mfite imyaka 16, nari nkiri umwana, ngira inda. Ntabwo nari nakabaye umuforomo, nigaga ibindi. Hanyuma biba ngombwa ko mbyarira mu rugo. Nafashwe n'inda nagiye gusura umuvandimwe wanjye, hanyuma abaturanyi banjyana kwa muganga. Aho banjyanaga hari kure cyane kuko twari dutuye mu byaro. Tugeze hagati tutaragerayo indira mfata, biba ngombwa ko banyinjiza mu nzu y'umuturanyi. Ndabyara, umwana aba muzima, ariko njye nyuma nza kugira ikibazo gikomeye cyo kuva, nza gukira n'umwana wanjye abaho. Icyo nicyo kintu cyatumye mpitamwo uno mwuga, kugira ngo nanjye nzabashe gufasha abandi.
Nongeye gutwita, nahisemo kutabyihererana. Umwana wanjye w'umukobwa yavutse ameze neza, yifashishwamo n'umubyaza. Twumvikanye n'umugabo wanjye ku mubare w'abana twari kuzabyara.
twumva onapo bwa mbere ikiza cyangwa se abantu bakishishikariza abandi wumvagamo ibintu by'ibihuha byinshi bavuga ko yica urubyaro, ituma abantu barwara mu buryo butandukanye.
Mu ntangiriro rero nkitangira kubyara nabanje gutinya kujyamo, bituma mbyara indahekana, ariko nyuma yaho uko bagendaga batuganiriza no ku bigo nderabuzima nahitiyemo nta kibazo nagize, turinganiza uburyo twifuzaga.
Hari byinshi nagombaga kwigomwa nk'umugore, ariko ndatekereza ko abakobwa banjye batazacika intege mu kugera ku nzozi z'ibyo bifuza kugeraho.
You can't stop your dreams because of a mere accident. First of all, you have to believe in yourself, because ideally, you're the first person who's got to believe in yourself to even convince others to believe in you. And then be determined and work hard and mean what you say.
UNFPA is working with the government of Rwanda, particularly to address the unmet need for family planning and to combat rising levels of adolescent pregnancy. This unfinished business calls for our advocacy and calls for our targeted investments, especially in women and girls.
Urya kanyoni katagurutse nikamenya iyo beze. Mama niko yakundaga kutubwira tukiri bato. Badata wacu babwiye data guhagarika kutwohereza ku ishuri jye na murumuna wanjye, ariko data ati
oya nzabareka bose bige kandi batsinde.
ubu ndakora ndi impuguke mu ikoranabuhanga, ababyeyi banjye bibahesheje ishema.
Dore icyizere cy'ejo hazaza, dore icyizere cy'ejo hazaza, dore icyizere cy'ejo hazaza, dore icyizere.
Thank you very much. That was a very nice video. Let me hope you enjoyed it. I really wish I could watch it again. It's professionally made and the artists did an amazing job and the stories are so inspiring. Now, Mr. Mark Schreiner mentioned something about the UN survey, and if you can check in the chat room, he posted something about the UN is 75 years old. Have you had your say? Now, let's shape our world together. Take the 1 minute survey after today's webinar. You can take the moment and it's just 1 minute. Now, it's very simple. Just go to un.75.online. You can take this survey so first and then enjoy your day. But that's after this session. Now, as we continue, for those of you who just joined, you're welcome. We played a game you missed out, but we'll play another one later on, don't worry. And now I'm about to introduce another young, interesting gentleman. As you know, UNFPA Rwanda, in close collaboration with the Ministry of Health, Ministry of Youth and Culture, and also other partners, organize different activities to commemorate achievements of ICPD program. Now, over the past 25 years, different activities have been done, and it was worth a celebration. Now, some of the activities included the Youth Caravan that was conducted by AFIAN Rwanda, which is African Youth and Adolescents Network. We are blessed to be with the vice president of the group. They did an amazing job. And now, ladies and gentlemen, allow me to welcome Mr. Evode Niyibizi, who's going to be giving us a brief presentation on how it happened and how it went down. Mr. Evode, the floor is yours.
Thank you, moderator, Honorable Minister of Youth and Culture, Country Representative NFPA, Representative of KOICA, Deputy Director General of Imbuto, different protocol present, panelists, young people and attendees. Happy International Youth Day. On behalf of the African Youth and Adolescent Network on Population Development, Rwanda, I'm glad to join you to present this youth communique on ICPD 25 as a product of the youth Caravan conducted by AFRIAN in partnership with different stakeholders and partners, as the moderator was saying. We are going to start from the meaning of ICPD for some who do not know about it. The ICPD stands for the International Conference on Population and Development. It is a meeting that happened back in 1994 in Cairo, where around 179 governments adopted the evolutionary program of view of action and called for women reproductive health and rights to take center stage in national and global development effort. Today, ICPD is often used a shorthand to refer the global consensus that reproductive health and rights are human rights, that these are preconditions for women empowerment, and that women's equality is a precondition for securing the well-being and prosperity of all people. The Youth Traveling Caravan was conducted by African Rwanda. It was launched in Rusizi, Muganza. It was on 11th July 2019, and it lasted 10 days through four districts, 8 sectors, and was concluded on 21st July 2019 in Kigali City. The aim was to listen from voices of young people and stories on achievements and remaining unfinished businesses, and the recommendations from those young people for the next step in advancing the ICPD agenda in Rwanda. We collected up to around 16 stories from young people around the availability of and accessibility to sexual reproductive and health and rights services, access to information, teen mothers' experiences, gender-based violence, to highlight the achievement and unfinished business in Rwanda. There are some highlights of the Youth Traveling Caravan. And the first of all is that we reached up to around 7,250 people. Among them, 223 people received the family planning services, where 114 received, which was 50%, 51% received long-lasting contraceptive methods. And we did HIV testing for around 579 people. So we were with an amazing group of young people, the At Rwanda Obuhanzi, that helped us to convey messages on ICPD agenda. They shared information on sexual reproductive health and rights through songs, poems, and drama. We've been able to get from the voices of young people some barriers to access to sexual reproductive health information and services, and some of them being young people in rural areas. Some of them still live far from the service centers, which hinder the accessibility of services. We've been able to see that there are some misconceptions around contraceptive methods, especially under short and long-lasting contraceptives. Young people and parents do not understand well the benefits of modern contraceptive methods, and that's a small percentage in rural areas. The following is that few service providers there are few service providers compared to the served population, which also affect the quality of service provision. There are some young people who are not aware of available services near them in youth corners, youth centers, leading to a reduced demand of information and services. Youth service provision by older people, older providers in some centers results in reduced number of demands. Not only the barrier, With the barriers again, we've been able to recognize that culture barriers are still there that hinder a change of mindset toward reproductive health. There is also some young people have highlighted that requirement of parental consent to access sexual reproductive health and the rights services is one of the points that hinders the demand. So there is poverty, low levels of education, gender-based violence, that were reported by young people to be some of the main cause of the current sexual reproductive health and rights challenges, such as high rate of teenage pregnancies. Not only these barriers, we've been able to get from them how they think this can be solved. And we sat together with fellow colleagues in our network to see what can we do to get these issues addressed. The way forward and the recommendations that we have is that we are calling on the Ministry of Health and the Ministry of Youth and Culture to increase the availability and accessibility of sexual reproductive health and rights services in every health post in all cells. The Ministry of Health and the Ministry of Youth are called to properly integrate the sexual reproductive health and rights youth-friendly services in all health facilities. The heads of youth-friendly services should ensure the friendly provision of services, preferably by young providers. We are calling on the government of Rwanda to remove all legal barriers, including requirement of parental consent to access sexual reproductive and health and rights services. We call all service providers to provide enough information to service seekers and encourage informed choices and decisions about contraceptive methods. African Rwanda, National Youth Council, and other youth processes will take the lead in raising awareness towards zero teenage pregnancy, zero gender-based violence, and zero new HIV infection. Last but not the least, after realizing the contribution of the youth traveling Caravan as a new innovative way to raise awareness and provide sexual reproductive health and rights services, we call the Ministry of Health, Ministry of Youth and Culture, Rwanda Biomedical Center, African Rwanda, UNFPA Rwanda, KOICA, Imbuto Foundation, Enabel, Society for Family Health Rwanda, and other stakeholders to prepare the scale-up of the youth traveling Caravan in other provinces of Rwanda. Thank you. I'm glad to show you the great delegation that we were together in Nairobi Summit back last year in November. It was an amazing delegation. Thank you.
Thank you very much, Mr. Evot. We actually enjoyed taking a look on the projects that you guys did, which is such an amazing work, especially the work done for the youth. Now, talking about the youth, we can't really celebrate today and forget some of the amazing partners that have been together with the youth all the way. I'm talking about the partners that are always there. In fact, I also mentioned about the partnership of UNFPA and KOICA. KOICA is a big partner when it comes to the partnership of the youth engagement activities. They really engage. And now KOICA is the Korea International Cooperation Agency, and they've been there, especially the outstanding job they've been doing with the youth of Rwanda. Now, it's with great pleasure that I welcome the Deputy Country Director of KOICA in Rwanda, Mr. Aaron Kim, for his remarks. Mr. Aaron Kim, if you can hear me and get me well, the floor is all yours.
Honorable Minister of Youth and Culture, Rosemary Mbabazi, UNFPA Representative Mark Brian Schneider, all development partners and distinguished guests, Muraho. It is with our great honor to participate in this meaningful occasion to celebrate International Youth Day, as well as to commemorate
I think we are having a network problem. Maybe if we catch him back again, we can continue with the speech. Mr. Aaron, if you're back, please, you can easily chop in with and continue with your remarks.
Yes. Bravo. It is our great honor to participate in this meaningful occasion to celebrate International Youth Day, as well as to commemorate the new project between KOICA and Rwanda. Their human right to equality, sexual and reproductive health, and freedom from violence and discrimination. As everyone already knows, COVID-19 is an unprecedented global public health crisis. It is not only threatening in terms of public health, but also reveals vulnerability of our society in many aspects. Especially sexual reproductive health service is being challenged. In this regard, we believe that the new project will be meaningful and helpful. Honorable Minister, for societies to thrive, adolescents and young people must have access to education, healthcare, and technology. They must have equal rights and equal opportunities. When they do, their families, communities, and countries will be developed and grow. So we came together today to celebrate International Youth Day to mark the important role of youth in the society, their strengths, and their needs. It is in the same spirit that I'm also delighted to formally launch the KOICA UNFPA multilateral project to empower adolescents and young people in Rwanda. We firmly believe this project will contribute to increasing the utilization of SRH services, raising awareness of available SRH services, and strengthening institutional capacity to deliver these services. KOICA really appreciate the good partnership with UNFPA and the implementing partners, Imbuto Foundation, RBC, AHA, All-Right, and Good Neighbors International, which will implement this project. It is our big pleasure to work with all of you for better lives of vulnerable people who are struggling with many challenges. Honorable Minister, Rwandan adolescents and young people look to your continued leadership in advocating for their KOICA as a committed partner. Work with you for better lives of youth in Rwanda. Thank you.
Thank you very much, and also piquing the interest of our Kinyarwanda words, now Urakarama, as I can say. And thank you very much for launching the project in partnership, UNFPA. Mr. Mark once mentioned it, and actually it's a good project. We are going to be knowing more about it. Before we continue, though, I can see more people are joining in, and also I see some comments like Wamniza saying thank you, Evod, for a great presentation. Viva Afriyan. I can see the engagement is coming up now. If you have any question, any question that you wish to ask the speakers or anyone that you want to address your question to, feel free, just type in your question, address it to the specific person you wish to answer that question, and just like that, it will be answered. We have everyone here, and you can easily get your answer. Now, Mr. Kim mentioned about the KOICA partnership with UNFPA. Most of us maybe don't know about it. I also don't really have more information about it, but I got you. I have someone who's got everything covered. Ladies and gentlemen, allow me to welcome Mrs. Young Jed Kim. She's the UNFPA Adolescent Sexual Reproductive Health Specialist, and she gets to know more about the project. Let's give her the space, and if you have any question, remember to just type in your question. Jed, the floor is yours.
Thank you so much, Arthur. Good morning, everyone. This is Hyanyang Jade Kim from Adolescent and Youth Unit in UNFPA Rwanda. Today, celebrating the International Youth Day and the launching of our new project together with KOICA, I'm very pleased to present about the growing partnership between KOICA and UNFPA on continued commitment on adolescent and youth in Rwanda. During my presentation, I will walk you through the key milestones that KOICA and UNFPA has been built and shed a light on our new project that we are kicking off this year. So this is a roadmap of the partnership between KOICA and UNFPA. The very first collaboration was made in December 2015 as the Korean embassy was supported the UNFPA on the sexual reproductive health and family planning activities in Mahama camp as a humanitarian response. And this very meaningful partnership continued in the very same year, in August 2018, as UNFPA Rwanda had on board the very first Korean staff as a Korean International Development Volunteer Program. And actually, the Inanga video that you just had seen, one of the brain behind this video was this Korean staff as well. And I'm very glad to share that a little more information on that. And in May 2019, KOICA supported UNFPA together with the Ministry of Youth and UNDP to scale up of the Youth Connect initiative. And many thanks to this support, we are continuing our Innovation Accelerator program, and we are very excited to launch our new phase 3 of iAccelerator very soon. And in the very same year, August 2019, UNFPA Rwanda had on board the Korean International UN Volunteer, and she's very much enjoying to working together. And hi, this is me. And today, on 2020, we are reaffirming and strengthening our partnership through our new project called 2020 Multilateral Cooperation Project. And now, I'm sure that many of you are very curious to know more about this project, as Arthur was asking. So I'm very glad that I already have answers to prepare. And let me give you the overview of the KOICA 2020 Multilateral Project. Great. So here we are. The title of the project is Empowering Adolescents and Young People in Rwanda to Realize Their Human Right to Equality, Sexual and Reproductive Health, and Freedom from Violence and Discrimination. This is a 3-year project starting from July 2020 up to June 2023. And the goal of the project is to support the government of Rwanda's effort to empower the adolescents and young people in the country to realize their human right to equality, in particular their sexual reproductive health and rights, and live a life of freedom from all forms of violence and discrimination. Under this project, we have 2 objectives. First is to increase the demand and supply of the sexual reproductive health and gender-based violence services. And the second one is to empower young people, especially focusing on most vulnerable adolescents and youth to access the education and socioeconomic opportunities. Seeing the beneficiaries of this project, We have, as a primary beneficiaries, we have adolescents and youth ages 10 to 25, both in and out of school, including those who are in the refugee camps. And the secondary beneficiaries include primary and secondary school teachers, our parents, religious and community leaders, healthcare workers, and youth networks, CSO, and NGOs. When it comes to the scope of the project, this project will be implemented at the national level with a special focus that the UNFPA is working in three key districts, which includes Karongi, Yamasheke, and Rusizi. This project will also be implemented in the 6 all refugee camps and their host communities in Rwanda as a humanitarian response. This project will collaborate with many government stakeholders. This will include the Ministry of Health, Ministry of Youth and Culture, Gender and Family Promotion, Emergency and Disaster Management, Ministry of Education, as well as Rwanda Education Board, and National Commission for Children. We have 5 implementing partners for this. As Mr. Kim mentioned earlier, we have Rwanda Biomedical Center, Imbuto Foundation, Good Neighbors International, African Humanity Action, and Alight. This is the end of my presentation, and thank you so much for your attention and joining for us today. I'm very glad, and we are very looking forward to implement this project to empower and support our young people in Rwanda. Turikume, murakoze cyane.
Thank you very much, Jed, and that was such an impressive project. We are looking forward to see how it's going to impact the youth and the young generation here in Rwanda. As I said, if you have any question that you wish to ask, maybe a speaker or whoever you wish to direct your question to, just go to the chat room and type your question. I will pick it up and make sure it's questioned and you get your answer. And now, if you just joined, you're welcome. We started with a simple game for those of you who weren't here, just to loosen up a little bit. We're about to jump into our next session. And before we do that, I would like to know if we are together. We have over 70 people following, and just give me an engagement from you. Anything, send me anything. Is it an emoji of a thumbs up? Is it just chance, just like we say in our gen? Is it like the energy? Is it, how is it? Give me something. Give me, okay, I can see Natasha. Natasha is very, very engaging, saying, yes, we are, Arthur. Let me see. Okay, I can see people dropping in some questions. You can also ask anything about what we are talking about today. Now, before I can see the energy from Mizera Annette, and yes, we are following. Thank you very much, Ingabire. I also see you. We are here. Twajiye means let's go. Okay, then let's go. I'm about to drop in another game. It's very, very simple. Now, this is not read my lips, but this is a simple one. If you can guess my action, I'm going to do something, and I want you to tell me what it is. I'm just going to do something, and I want you to tell me what I'm doing. Okay, then. Now, this is it. What am I doing? Oh, okay. Oh, combing. Okay, maybe I'm very bad at my actions. Combing. Everyone has gone for combing. I can see. Okay. Somebody. Okay. Somebody mentioned it, but I won't say who. I see. Okay. Let me just drop in your answer. I want to see more before I switch and tell you what the answer. Scratching your head. Oh, come on. Did I do this? Lol. Okay, I see you. Whoever said shaving, you did a good job. And if you think it's combing, maybe it's the way I was holding the comb and you thought it's these big ones, but it was actually the shaving machine. I was shaving my head. Anyway, just trying to loosen up before we jump into the next session. And this one is another beautiful moment, talking to some of the young people that we have on this panel. Now, some of them are familiar with the conversation we are going to have. You've actually met one of them, Mr. Evod Niyibizi. He's the Vice President of AFRIAN Rwanda. He gave us a presentation of the communique from the Caravan. Javela Dusengimana, she's an attendee of the Youth Model ICPD in Cairo, which happened in Egypt. Miriam Nsekonziza, she's an ALU student at SHR, well, the abbreviations can get confusing, but it's Adolescent Sexual Reproductive Health Advocate, and she really understands more about what we're about to talk about. We also have Superior Iradukunda. He's the co-founder of the Flavors of Family Planning Accelerator Phase 2 winner. He's here with us, and I'm blessed to have them. Can I have you guys on camera so that I know I'm not talking to myself? All right, I'm assuming I have everybody on camera. I can see you a vote. And now jumping to the first question, we want to discuss about the youth here in Rwanda, especially when it gets to the adolescent sexual and reproductive health services here in Rwanda. I'll start my question straight to Javela. Javela, thank you very much for joining. Now, I would want to know, how would you describe the accessibility and affordability of adolescent sexual reproductive health services here in Rwanda? And maybe you can tell us if there are some key areas that you think are doing well and what can be improved.
Thank you so much, Ata. I'll start by appreciating so much our country. Our country has been so good, doing a very good job with providing the service of research, especially to young people. As Edward mentioned in his presentation, they've established youth corners in every health centers, and it's really remarkable how it has been so helpful for youth to be able to have that. Rwanda has been also giving services to youth through parents and adolescents communication sessions and different innovative strategies such as empowering community health workers. Rwanda is also trying to bring health services closer to the community as achieve quality health services provision. We also have target. They also are targeting adolescents both in and out of schools to peer-to-peer communication services. Areas to be improved. There is still lack of knowledge and misinformation, especially among adolescents, especially where adults are still tells young people that the medicine to acne, to have sexual intercourse, which we all know that is wrong, but some adolescents or some young people still believe that that's right. And these young people really tells them that it really works. We also have a very serious issue where some young people are still not able to afford these contraceptives, especially in rural areas. Yeah, that's all I can share now. Thank you.
Thank you very much, and thank you for bringing out the issue of affording some of the methods needed. Mr. Spirian, I know in your area as a doctor, you can also tell me, what do you think are the areas that are doing well and where do you need to change? Maybe you can also tackle on the issue of affordability and accessibility. Spirian, you can take this one, please.
Thank you very much. Are you hearing me now?
Yes, I can hear you.
Well, actually, when you talk about affordability and accessibility, you can see that the country have done much on affordability, but when it comes on accessibility, we still have a challenge. The challenge of accessibility is due to the fact that those services are being delivered by elderly people or being delivered in combination with other services. Examples you can take in pharmacy. In pharmacy to sell pills, condoms, but also in combination with other medications. And some people feel stigmatized to go buy pills, emergency, for example, or condoms. And then there is the other one when they are buying paracetamol. That's a very big challenge. I noticed that there is a lady I met during my daily career. That lady came in, she was pregnant, and when I was taking the full history, she told me that that pregnancy was not intended. I feel curious, then I asked what happened. she told me that she had unprotected sex with her boyfriend. Then when she went in a pharmacy to buy pills, she found that the other people was there. So she felt stigmatized, and then she turned back home. That's how she ended up getting pregnant. So with this issue of unintended pregnancy, and especially teenager pregnancy, I and my colleagues started a way we can help those kind of people. And then we started a flavor of family planning, the one you talked about, which is the I-Accelerator Phase 2 winner. Those who don't know I-Accelerator, it's an innovative way of supporting young people, supported by Imbuto Foundation in collaboration with UNFPA and KOICA. We did really appreciate their contribution. And the aim of Flavor of Family Planning was to engage men and breaking the myth around family planning, as well as providing confidentially those services. To me, the main challenge that we have to solve is the problem of how those services can reach to the end users who are youth confidentially. Thank you very much.
Thank you very much, Spirian. Now, Evod, this question is going to you. According to the statistics given by NISR in 2019, it says the current population is around 12.3 million people, and 60% are the youth. Now, 40% under the age of 15 and 20% between the age of 15 and 24. I would like to ask you this question, especially like you who was engaged in different activities with the youth. How can the youth be engaged in the adolescent sexual reproductive health services? And if you can specify maybe any activities in which you feel like actively involved, maybe, and also tell us what do you wish the youth they could do more or get more involved with?
Yeah, thank you very much, Arthur, for this great question. Actually, very important for today's conversation. And to start, I'd like to say that young people and adolescents, as the target population, are the key players to design programs and the services to address the issues they face. It is very important to build on voices and their voice and ideas. We appreciate the engagement of young people in different platforms. For example, Afrian is as a voice of adolescent and young people around sexual reproductive health and rights in Rwanda. We are member of different technical working group, including the adolescent sexual reproductive health and the family planning technical working group. We are recognized by different stakeholders, which makes our voice to be heard. Young people are very much involved in the emerging innovation. One of the typical example being the I-Accelerator, as Dr. Cyprian was saying. And in this, the young people were given the great opportunities to show that they can give great outcomes. It is an evidence of the need to engage young people, even in policy making, decision making regarding their sexual and reproductive health and rights as well. I can say that what we need to do is to count on and engage young people, count on and engage young people again and again to make sure that they contribute, they give the solution to different issues, because I consider them to be the specialists of their own issues. Thank you, moderator. Over to you.
Thank you very much. And you brought up a very nice point when it comes to being part of it. But of course, they are not the only people that should be part of this. We are looking at parents, community health workers, teachers, religious leaders also being part of this. When you look at the numbers that I got here, the proportion of adolescent girls, that's 15 to 19 years, who've begun childbearing, that's a teenage pregnancy, has increased in the last 10 years. And it's now at 7.3% compared to 2010, which was 6%. Now, when you even reach the age of 19, the figure rises to 21%. If you look at the role the parents play and the teachers and the religious leaders, What can you say about it? What are they doing? How are they doing as the youth according to how you see it? And maybe I'm actually want to go with Miriam. Miriam, if you can hear me, you can answer this question well. What do you think the parents are doing? Are they doing it right? Or you can tell me your take. And of course, which effort could be strengthened to tackle the rising issue of teenage pregnancy?
Thank you very much, Asa. Yeah, this is a very serious issue that calls upon everyone. Like really, like you said, that the adolescents are not the only ones who are going to be taking part in solving this issue, but bringing about parents, because we believe that education should begin at home, and we should understand that adolescents will more likely want to listen to their parents than maybe getting the wrong information from their peers. In as much as they would want to discuss these things because of how comfortable they are talking to their parents, maybe more comfortable to their peers than their parents, but we really trust that parents can give them the right information. The problem is, we have seen a less involvement of parents in reproductive health education. One, some parents do not have the right information. They don't have enough information because they were not taught themselves. Two, some parents, like we've seen some of our teachers, are not comfortable talking about such things. They feel like, according to our culture, according to tradition, this is something that is very confidential. It's a private matter. Somebody should get to know it when they get, let's say, involved in sexual activities as they grow on to make families. Three, they also sometimes do not understand the intensity of the problem we're facing right now. Like, we can be sure about, if you have not had your child get pregnant in your own house, or let's say somebody close to you, you will not understand how it is an issue for the people who have their adolescent 15-year-old or even less bringing babies at home and creating a cycle of poverty to families who cannot even handle the previous families. So I would really very much encourage everyone involved to help change the mindset of parents. Get them to get comfortable talking about these things. If it is help they need, we need to provide it. If it is material, the information they need to share to their adolescents, let it be provided to them so that when they have to answer questions of curiosity from their adolescents, they have the right information. And that could actually build confidence and encourage them to teach their adolescents. So I feel like mindset shift. Instead of our parents telling us, oh, you see, you're going to get to know, you will know when you get older. Or they used to tell us kids they come from, I don't know, umbilical cords and stuff like that. Let them be sure about what they're going to tell their adolescents and start creating a culture of talking about it. Maybe that would help. Yeah, thank you.
And thank you very much. I would also like to take an opinion from Spirian. You tell me, what do you think can be done? And if you look at what the parents are doing, the community health workers, what they are doing, what do you think is your take on that?
Well, in fact, we do really appreciate the role and the contribution of some parents, some religions, and some community health workers. Though there is still a very big gap when it comes on inter-family discussion between parents and children concerning sexual and reproductive health. I said this because I met someone, she was also a lady. Then when I was giving a session, a SRH session, she came up at the end of the session. She told me, hey, doctor, can I ask you a question? I said, please, yes, you are welcome. And then she asked me, my mom told me that if I do sex with condom, I would end up having a cancer. So in order to prevent cancer, I decided to do unprotected sex. It's very shocking, but the idea is that mother doing so was not like permitting or allowing her to do unprotected sex. Rather was like scaring her not to do sex, but she ended up misled her. And then with this, I say to end this issue of teenager pregnancy, there is also a need of men and boys involvement. I said this because when I take like two facts, the first one to be, there is no single pregnancy that might ever happen without men's involvement in that process. Never. We should remember that one. Number two, that's also another fact. When you see how human beings are made, one female can only deliver once a year, contrary to a man who can impregnate more than 1,000 female a year, depending on how energetic and sexually active he is. So you see, if we want to tackle the issue of teenager pregnancy, we really need to involve, to engage, and to be familiar with working with men, as they are also a very big concern and they play a very big role in this matter. So we really need the engagement and education to end the issue of teenager pregnancy. Thank you very much.
Thank you very much. Thank you very much. I know I'm not supposed to add the third person to talk about this, but I would like to hear about Javila too on this question. Can you tell me, what do you think about this?
Oh, thank you so much, Aka. Most of you guys talked about parents and I don't know if I had someone talking about teachers, but I'll mostly talk about religious leaders. In Kinyarwanda proverb, we say, "Ija kurisha ihera ku rugo," and I work from that area. So I would start by appreciating some church leaders or religious leaders that are really helping young people, that are really helping youth in this area. I myself work in Anglican Church, Kigali Diocese, and they're doing a great job. I work in the Department of Youth, and we have a lot of programs that really help young people. We have, for example, a program called GFS, Girls Friendly Society, where we help girls to have time to talk, share what they're facing, what their issues, and they also get a chance to meet their mothers. You know, in Rwanda, we have a culture where girls used to meet their aunties, and they used to talk. And as we know, we faced a very big issue of losing an elder generation. So what we do is to create these boards where young people can meet their mothers or other old people to talk, be free and share. That's not the only thing we do. We also have a program that's called Youth Friendly Church, where we encourage church to talk to young people, pastors, but I really don't want to only talk about that, because we also have other religious leaders that still take it as a forbidden thing. They really don't want to talk about it. They think it's something that is not to be presented before people. They think it's something to hide, while we all know that young people are already involved. We have a lot of youth that are getting pregnant. As you just talked about how numbers are raising. So I don't think it's still something to hide, and I would really encourage religious leaders to do something tangible. I always tell people that it's something that needs to be in front of the pulpit so that everyone that is there can hear, and always encourage them to get solutions and long-lasting solutions. So that's all I can say. I would especially encourage those who are still behind, those who still think that it's something to hide and not to talk, even parents, actually, some parents still think. Recently, I shared a story of two women I overheard speaking, and one was telling another that she moved her daughter in one school to another because she heard there was a girl using family planning pills. And my question was like, why? What was the issue really? Was the issue using that prevention methods, or the kid was the issue? Or I really couldn't understand. But the bottom point was, instead of running away of these things that can help us, let us face them and let us look for a real and long-lasting solution. Thank you.
Thank you very much. I can also see questions popping in. We'll take some moments of answering those questions. And also, if you have any question, remember to direct the question to whoever you want the person to talk about it. Now, before we continue, let me also bring out this point. Just tap into the gender-based violence issue. When you look at the statistics given by DHS in 2014-2015, 4 in 10 women and 2 in 10 men aged between 15 and 49 years report having experienced emotional, physical, sexual violence from their partners. Now, according to DHS, again, 42% of women think their husbands have the right in beating them for several reasons. No one reports it. Banning the food can be a reason. Refusing him to have sex becomes a reason. Now, I'm going to start with a vote on this, and I would like to take an answer from all of you. A vote. Looking at the gender-based violence becoming a big issue in the society, especially now during the COVID-19 pandemic and the lockdown, you may see women and girls justifying the issue, like, yes, I can be beaten, it's okay, he's my husband. What do you think, and what do you think can be done to change the situation?
Thank you, Arthur. Let me start by saying that I had a chance of getting views from different people, or different families in lockdown. But again, what I've been able to see is that the COVID-19 pandemic and lockdown have imposed a time for some families to stay together much longer than before. For some, it was a good opportunity for them to connect well and to be together. But again, for other families, it was so unfortunate that we have seen some rising cases of gender-based violence or domestic violence as a result. It is an evidence of how we need to strengthen, or how we need to tackle the factors behind the gender-based violence and domestic violence to address them in our society. So I acknowledge different programs which are in place to contribute in ending the violence, but again, we need to also think more on addressing what could be the root causes of violence in our respective families, communities, and society. It is very important to keep advancing this and strengthening the legal aspect toward a gender justice society, and to let people know the current laws which protect them, as some cases of violence keep happening repeatedly and remain unaddressed as a result of lack of awareness of protective laws in which are available in a country. Let people know available services, how and when and where to look for help on time when they face any violence. So addressing violences on time will solve also the numbers of those that can arise when you don't address the available cases. So last but not the least, and more importantly, we need to raise a strong awareness for the change of the mindset. So most of the cases of violence are behind the mindset of people. So we've been having what I can call the old culture, which results in violence. But again, the aspect to which we take a woman in our society, or a young girl, or whoever who is being violated, need to change. We need to break those culture barrier. We need to change the religion beliefs barrier to end the violence. Just educate our adolescents and young people who are shaping the next generation free of all kinds of violence. Thank you. Over to you, moderator.
Thank you very much. Miriam, you can take on this. Evode just said we need to educate and educate and educate. What's your say on this point?
Well, thank you very much. I did not think the point could be totally different, but like he said, the biggest thing we'd ever do is educate people, because we can take on responsibilities of putting people to justice, which is a point that I want to mention about and enforce. But we would have much more energy wasted if we were just running after people like criminals, other than getting them to understand why we're actually stopping them from doing whatever they're doing, then have them join us. Then we teach the few that are left, maybe who do not understand and take time. So like you said, in this particular situation where people cannot leave their homes and they spend more time together and they justify reasons to why whoever their partner, their spouse is beating them, especially with a culture where we've grown up and hearing people telling each other, I would quote in Kiranda, they tell each other that that's how families are built. Like if your husband beats you, then suck it in and be a wife, stay there for your kids. But I don't know how you're going to stay there for your kids when they see you being beaten by your husband, or you're going to be there as a father if your wife harasses you. So culture, mindset shift is a very key important thing, which is done through education, like Evod has said. So whatever route we'll use to educate these people and change their mindset is something we should adopt. Number two, I always think that to me, because of how heavy I find gender-based violence as, I think it's something that we should act on as an emergency situation. So if we have to give self-justice and follow up on the perpetrators, put them to justice, pay for whatever damage they've caused, and help the mothers or whoever they've violated with their resources, let it be something we do fast. If, in my own opinion, if we would have a court just set aside for adolescent issues, like every girl we find out that has been violated, let it be something we act on fast, not be piled on the list of courts that we have in where we are comparing somebody who's complaining about a land problem with somebody who has a girl who's been violated by a man who's older than her own father. So yeah, emergency response to this kind of situation, so that we do not have these kids afraid of reporting, especially because they're being threatened. And lastly, we've had cases of gender-based violence increase, but we do not see a proportional increase in reported cases. So if there's a way that we would find and create policies and places, a security protection method to protect the victims, because some of them are afraid of reporting because they've been threatened by their perpetrators. Like, if you report this case, I'll kill you. Some literally do actually do that. You report, they kill you. So if we can find a way to protect the victims as they report, and we find a place to put them in a security kind of place where they are sure that while the case is being followed up and the perpetrator is put to justice, they have all the security they need. Then we'll have more people be free to report, and more people will find it right to educate other people. Like, we can reduce the cases of people that are being really imprisoned for violence. So education, justice, and really all done fast and together. Thank you.
Thank you very much, and I really thank everyone that is joining in. We also blessed again to be joined with Honorable Minister of Youth and Culture, Mrs. Rosemary Mbabazi. We really thank you very much for being with us. We are just discussing as the youth certain issues that we are facing, especially during this pandemic when it comes to gender-based violence. Let me jump to Spirian. Before I go to Spirian, I can see Javela ready to jump in. What do you think about this issue of gender-based violence?
Thank you so much. First of all, let me really thank our country for everything they are doing to prevent GBV. It's remarkable. It's remarkable. We have Isange One-Stop Center. We have publications and information being given through everywhere, social media, radios, dramas, but we really still have issues. We can't sit and close our arms and say that we've reached. And some of women don't really, up to now, don't know their rights. And I think that's one of the main issue we still have, especially as I mentioned before, in rural areas where women are not able to access the information. They don't know their rights. Recently, I talked about a woman I crossed, and she was heading to the pharmacy, and she has really been beaten up. And when I asked her, she said, "Ha, mwana wanje, sewa wagabo numwe nawe uzayibona," which means the father of men is one, and you also face the same issue.
Yeah.
And they really think it is right, and that's how it's done. So I think the most important thing we still have to do, as my colleagues mentioned, is to spread information everywhere. When I attended Youth Model ICPD 25 in Cairo, we really talked about social media, how this information should be out everywhere. We should also use social media as much as we can. I mean, we're not talking about women here only. We're also talking about young girls that are being violated, that are facing a lot of hardship. And they really don't know where they can go to. They don't know who to ask. And actually, some of their parents still say, hey, we can't talk about this. It's her uncle that did this. It's our neighbor. I know a case of where parents are saying it's our landlord. If we talk to people, what is going to happen? We are going to be sent out of this house. So we really still need to talk to parents and women, especially girls, and also men, that these things can be corrected, and there are people who can address it rightly, if I can use that word. I recently was listening to Kiss FM, and they were trying to talk to, they were receiving questions from women, and some, I think it's a woman who called, and she said, if I call, how do I make sure that this information is going to stay inside, that it's not going to be public? And they were ensuring them that these people are working with RIB, with police, and this is really going to stay privately as they wish. So I think the main issue that is here is to let people know their rights, and also assure them that this information will be kept inside and not go public. So thank you.
Thank you very much. I know Spirian would have something to say about it, but due to the time issue, I'll come back to you a little bit later. Looking at what you guys have said, I picked up engagement, communication, the flow of information, and also not forgetting treating it as an urgent matter. And now, Spirian, please, using 1 minute, I would like to take your say on it, and then we can jump on to the others and give them the floor also, because I've seen so many questions coming in.
Well, actually, when we talk about the GBV, first of all, I'd like to appreciate the government of Rwanda for the zero tolerance to GBV, which is very good and interesting. But for me, I want to be short. My view would be to consider both male and female while tackling the issue of GBV, because there is a small percentage which is not neglected, which have not to be neglected of GBV announced by men. For example, there is a client I received at the hospital. He was a man, have been cut by his wife. And then when I asked it, he told me that she used to beat him, but have never reported that. I said, but why? He told me, according to Rwandan culture, it's very shameful to go and report that your wife is beating you. So I said, to end the issue of GBV, we need really a strong awareness and education, tackling both male and female, and also to tell them what to do in case GBV happens. Thank you.
Thank you very much, Spirian. We've just had such an amazing, engaging conversation. I picked up different things, and I'll be coming back on some of the points. Now, for those of you guys who've just joined, we started with a lot. We did some games, we laughed, we smiled, and we also get to have speeches from different speakers. We are joined by different people, like the Deputy Director from KOICA, the country representative of UNFPA, and it's amazing. We had a lot of engagement. We discussed about the global action, which is the theme that we are having today. Access was one of the words that that kept coming here and there. People are saying the access to information, access to the services, and it's something that we kept on discussing. You can scroll down, and I'm pretty much sure this video will be available on YouTube, so you can get to rewatch it and understand what we went through. The conversation with the young guys, we talked about engaging, communicating, treating it as an urgent matter, and also not forgetting keeping it a little bit private so that people don't feel vulnerable when they give out their secrets. And also we had a chance to get to hear from Jed, who presented us the partnership between UNFPA and KOICA. Now, let me quickly jump into the questions that I've seen coming in. I got a question from to Javela. There was a question to Javela. I don't know, Javela, if you can hear me, get ready. What can we do to help girls help themselves by preventing them from being lured into sexual activities?
Thank you so much. That's a very hard question to answer, but it's something that is one of the things we've actually talked about. The first thing I think we can do is access to information. They need to know what happens. They need to know more than you are going to die when you have sex. You know, they need to know more than, I always tell people a story that when I was a little girl, my dad told me, I'm happy he's not here to hear that. He told me that, Javi, you know, you're very beautiful, you're my little girl, but I'm the only one who can see your beauty. If any other man tells you that you're beautiful, know that he really hates you. And it took him for his words till I don't know how old I was. And that was a very long information. Now that I know, it didn't protect me at all, because there is a time that I knew that what he sees, anyone else can see it. So I think we need to let these young ladies be able to know the reality, access the right information, and know also their bodies. We talked about health reproductive. They need to know what's happening. They need to know that having acne, I just have one here right now, that it's normal. They can come and they go. It's part of their life and their bodies, and it is right to be like that. And they also need to know that there will be the right time. We talk about pills, we talk about family planning, we talk about condoms, but there are also other options, and they work. Not to everyone, but they work. They also need to have that access of information and know that there will be the right time for that, when they'll be able to not actually use all of those, but they also need to know that there are also other options. And they need to know that there are options they can take. Thank you so much.
Thank you very much. They need to know their options. We also have some comments from different people. I'll start with Divine Ingabire. She said the pandemic and school closure also meant that already vulnerable girls are even more vulnerable due to lack of information around their bodies and sexual harassment and abuse, often leading to unwanted pregnancies. I personally think it's an urgent need to address, even with the ongoing pandemic, especially schools open in September. She says this should be a message that goes throughout this whole period. I'll read out another comment from Serge Ndajijimana. He was like, there is a need to disseminate and improve information, specifically tagging young people's knowledge of sexual reproductive health. About unattended pregnancies in Rwanda, we also need to create an equal, non-stigmatizing and more friendly ways to access sexual reproductive health services for young people, involving them in decisions and policies being made around the subject, for they need to know. Thank you. Thank you very much. I'll take the second question. And this question goes to Teresa, the head of adolescent and youth unit in UNFPA. Teresa, if you're online, please, you can activate your camera. And the question goes like, in Rwanda, more teens are found in secondary school. Recent time, we are finding some teens feeling shame when turned to menstrual period due to non-trained teachers or colleagues. Not only that, some teens lack facilities to help them getting the pads or other essentials. Now, as UNFPA, what are you doing to empower those teens who are facing problems like those issues they are facing at school?
Thank you, Atta. Thank you, colleagues, and thank you, young people, for really joining us today. Thank you, Honorable Minister of Youth and My Culture and Culture. So the question is really a very good one, and the answer to that is maybe a reference really to the current curriculum for primary and secondary schools. UNFPA and the other partners, really, we worked together with the Ministry of Education and especially the Rwanda Education Board to integrate this comprehensive sexuality education in the national curriculum. This was a major milestone. I think you can even Google online how many African countries, especially in our region, East and Southern Africa, how many have integrated this subject, comprehensive sexuality education, in their curriculum. You can count them on your fingers, but Rwanda was the first country in the region to achieve that major milestone. So now we have the subject in the curriculum, but the challenge is how is being delivered now at the classroom level. Do we have enough capacity for our teachers to confidently talk about these issues? Issues like a menstruation, issues like a puberty. So we still have those challenges in our schools. So as the UNFPA, we are also working with the ministry and the Rwanda Education Board to address this issue, especially the capacity of our teachers to confidently speak about those issues and also integrate this subject, at the level of the classroom. But we don't end there, we don't stop there. We also work with the parents because, parents are the primary educators for sexuality education. Because when the children are born, they are born in a family. And our socialization process should take into account those issues. Let's start talking to our kids as early as possible about those issues. Let's help our kids when they are very young, toddlers, to understand themselves, to discover who they are, and also, build up as they grow up, so that by the time they reach puberty, they are already aware of any changes that can happen to their body, and also how to prevent these, unnecessary or unintended, pregnancies. So there are various issues. Like I think it is Miriam who talked about this, parent involvement, and we talked about this parent-child communication. And we know one of the partners really who has that expertise in our country is the Imbuto Foundation. They have even developed some, booklet to really help parents engage, kids and their children in a conversation and now demystify issues related to menstruation, issues related to, to sex, to really encourage young people to delay, sexual debut. And we have enough evidence to suggest that when this comprehensive sexuality education is properly, integrated and delivered, and there is also a partnership with the parents, teachers, and other stakeholders, young people actually delay, sexual interaction, activity. So we have to use that evidence to make sure that we invest enough in building the capacity of our teachers and also of our parents to speak confidently about those issues. But also young people themselves to really understand their role, to ask really questions, and then also use the opportunities available, especially like the youth-friendly services, the youth corners, approach like health service providers in health facilities to acquire enough information. So that is what we are really trying to do, to build that partnership between health facilities and schools, whereby even a school can invite a teacher to come to the school to tackle some of the issues maybe a teacher has not enough knowledge about. So I think in a nutshell, that is what I can say. Let's take advantage of the fact that we have already CSE in our school curriculum. Let's build the capacity of our teachers to effectively deliver this subject. Let's also build the capacity of our parents so that they can effectively also engage in a very healthy conversation with their kids. I thank you. Over.
Thank you very much, and thank you for bringing up that. Before we go to the next question, we actually have Geraldine Umutesi, Deputy Director General of Imbuto Foundation. She's with us, and I have a question for her. It will be coming up just in a few minutes. Let me first jump to Miriam. You have a question for you from Uwamahoro Blandin. Reproductive healthcare strategies to meet women's multiple needs include education for responsible and health sexuality, safe and appropriate contraceptions, and services for sexually transmitted diseases, pregnancy, delivery, and abortion. Now, the question is here, what can we do to help girls help themselves by preventing them from being lured into sexual activities? Miriam, this question goes to you.
Thank you very much, Asa. Like Savella said, that's really a serious question, because it involves a lot of things to do, and it's not something that we can solve overnight. But I stand on the view that if everyone can do their part, then we are sure that we have protected these girls from being lured into sexual activities. By that, I mean, we find multiple causes to the increase in adolescent pregnancy. Some girls are taken into sexual activities because of financial hardships, where whoever is taking them into the activities is giving them, let's say, money, materials in return. Then they get pregnant because they do not have a protective measures, which brings me to a second cause, which is lack of SRH information, where they do not have enough information about contraceptives. Their beliefs are still low because they haven't been educated, and also to the causes, or another cause as violence and other causes that can come after all this. So while we want to stop these girls from being taken into sexual activities, I always think that number one is to educate them and empower them, so that those that we know have gotten themselves into the sexual activities, not as a result of violence, because they gave consent. They say, or like we saw in the video, the girl said, if the guy loves you and he's been giving you things, he bought your phone, he gave you a dress, he gave you money to use whatever you want, then you would always feel guilty not accepting to have sex with him, because he has shown his love through the material things. So if we educate and empower them with the idea that if I can't abstain, there's contraceptives, there's protection measures like condoms and others that are available. So we educate them. Number two is that as we empower them to be self-reliant, I always feel like that's another solution to stopping these girls from getting involved in sexual activities. If there's a skill that we can give these girls so that they can work, especially because they're idle, they don't have things to do. Let's say right now they're not in school, or those who dropped out because of financial reasons, or those who finished school. If they have a skill that can generate activity, generate income, if there's something that we can give them to get them busy, I'm sure that they will have less chances of getting involved in sexual activities. Lastly is informing them about their rights and also help them. Like we are sure that if you're in a position to help a girl that comes to you and says, I have this person who's been trying to persuade me to do the sexual activities, teach them not to do it, but also follow up on this guy, because if the guy is older, he has a mindset and he has multiple ways to manage to convince this girl to get involved in the sexual activities. So thirdly, educate them, empower them, provide them with the skills, basically help them rely on themselves with information and with things that they can do to have their lives running, other than always feel like they depend on another person for their survival. I don't know if I've answered your question.
Yeah, thank you very much for answering that question. As I had mentioned before, we are blessed to be with Geraldine. She's the Deputy Director General of Imbuto Foundation. I don't know if you can hear me, Geraldine. I have a question for you from Andre Rugangangabo. And the question is there any plans to engage prenuptial consultation to youth that want to get married, if there is any projections? Well, this question goes to Geraldine from Imbuto Foundation. And remember to also send in your question. If you have a question that you wish to ask anybody, you can direct it to whoever you want to ask. And now you can just go in the chat box and send in your question. I'll pick it up and make sure that we direct the question to the right person that has to answer that question. And now the question asked was from Andre, and the question goes, if there is any arrangements in terms of engaging with a prenuptial consultation to the youth before they get married, do they get to have any talk, any consultation before they get married? If there is there any projections? And before we wait for her, maybe Evod, if you're willing to take on this question, or anyone, Spirian, anyone can take this question before we jump to Geraldine.
Good morning, everyone. Sorry. Can you hear me, Arthur?
Yes, we can hear you. I can hear you very well. How are you? Good morning.
Good morning. Sorry. Good morning, everyone, and thank you for this opportunity. Thank you, KOICA and UNFPA. To the question, I would like to let everyone know that called the youth-friendly services, and the package of the youth-friendly services also include the prenuptial consultation, and also what we do with the health centers and also the youth-led organizations is about engaging young couples before they get married. So these services are there, and the prenuptial consultation is not only the way we used to go to the church and meet pastor and have a conversation. It's beyond that. There's also the medical consultation. There's also discussing about the future of your family, the future of your kids. Are you going to have how many kids? How are you able to conceive? These are things that really young people can get before they get married, and the services are there in the health centers. Thank you so much.
Thank you very much. Evode, I had given you some time to answer a question. There is a question for you, actually. People are following from YouTube. You can also follow on YouTube. For those of you who are following on YouTube, hello, I am saying hi to you. And the question came from Desiree Nharabaho to Evode. Now, Evode, what can us do to help the youth in rural areas understand their rights so that gender violence can be decreased in rural areas? I think what he's trying to ask is what can be done to help the youth in rural areas to help reduce gender violence in those areas.
Yeah, thank you very much, Arthur and Desile, for the question that you raised. I would like to go back on the previous answers that I've given. So what we need to do specifically is to let them know, the different information that they need to know, like laws regarding gender-based violence, laws regarding gender protection. Educating them is one of the key tools to have them getting free of gender-based violence. So, and the education won't be done by anybody else except only young people are the one to do it. So if young people are empowered, they'll be the one to educate even their fellow young people. So we can't say, we can't fail to say that there are some young people who are there who are empowered who can do that work. So the only thing that we need to do is to try to empower them so that they can educate their fellow young people to transform the generation that we want. I put it together with the question that was addressed to me also regarding the scale up the youth Caravan. This is one of the things that we've been doing. We've been discussing with different stakeholders to see how we can extend or we can scale up the Caravan contribution in different districts, because we have been able to see that it's a great contribution in the community, and I'm sure that after the end of this COVID pandemic crisis in Rwanda, we'll be able to do more and more activities. I want to make you ready, young people present here, to have you participating in the next step of the Caravan. That will address also one of some of these issues that you are raising, including the gender-based violence. Thank you.
Thank you very much, and thank you for bringing that up, getting ready for the next Caravan, because somebody had just brought it up now. Thank you very much. Let's just do this, going into the chat room, send in the clapping emojis, just to show like we are, finishing up with this moment. You can just clap for me to see the engagement. Yeah, okay, I can see more comments are dropping in, but I just want to end this session, and thank you very much, Javela, thank you, Miriam, thank you, Spirian, thank you, Teresa, thank you, Geraldine, for your answer. Also, not forgetting Evode for participating with this. You did an amazing job. Now, as I told you, we are blessed to have the Minister of Youth and Culture, Honorable Rosemary Mbabazi, to be with us. I cannot continue without having her take this moment and give us the remarks, and also saying hi to the young people that are with us today. Honorable Minister, the floor is yours.
Thank you very much, Arthur. Ngaramutse. Hello, everyone. I hope we can hear each other. Do you hear me?
Yes, I can hear you very well.
It's very exciting to listen to you. You are all excellent. Great ideas. I can't imagine how much I learned. I've been putting notes and notes and notes and notes. So you can imagine how you are educative. I really want to thank you. Very exciting session, very exciting speakers, very inspiring young people. We thank you very much for this moment. And as you rightly said, I feel like everything was said and the young people have done a good job. They are really engaging. They have engaged us instead. Thank you very much. I wish to take this opportunity to thank the organizers, the representative of UNFPA, Mr. Mark Schneider. We thank you very much for doing a good job. Deputy Country Director of KOICA, the Deputy Director General of Prenuptial Foundation, the speakers, the young people, and all the partners on this forum. Thank you very much for being there, and we appreciate the work you're doing in your respective fields. And I also want to take this opportunity to wish you a happy International Youth Day. I wish to express my appreciation again to our young, brilliant speakers for their contribution to the conversation today. Hearing your position, learning about your efforts and your commitment is very important and encouraging. And there's a comment that was given by one of the speakers, the gentleman. He said involvement of boys and men is very key, because also they might be having a root cause to one of the challenges, especially, there are many challenges, but one of them is the teen pregnancies. So involvement of the young boys, boys and men is very key. And I like even the gender sensitivity of the panel and all the discussions. I applaud the work you're doing, but also involving parents. As parents, how much are we keeping this as a taboo? Is it still relevant at the moment? I am a mother as well, but in this lockdown is where I got more time to speak to my boys and my girls about, especially about their body. Though you could find time, but this is a moment, everything has a good side and a bad side of it. COVID had a very bad side, but the good part of it is the use of technology. We can access many people at a go. I saw about 70 and more on this platform. And also having time for the parents and the children and the kids at home to speak and communicate, but also engaging in the community. So the challenges we're facing right now or today as young people requires boys, men, parents, community, and faith-based organization. I think she spoke very well, Javel, about the role of the faith-based organization, the church, and everyone involved in the mindset, in the thinking, in the spiritual aspect, how we influence the young people in this field, or make sure that they make the right choices. And it's particularly in the discussion that we had today was about curbing the teenage pregnancy. As the theme calls for youth engagement for global action, youth engagement for global action, meaning we need to have more young people engaged because there are many challenges that we have globally. And as being the young people, the energy, being the number, the power of your number, it means that we need you acting globally, but starting with your own community. The world, your nation, your communities look up to you as solution providers and leaders of change to the challenges we face collectively today. Today, there are many opportunities. There are many opportunities to tap into and have constructive contribution. The opportunities lies in the policies, laws, and the entire regulatory framework that provides space for the young people. The platform, the spaces that, like this one, are geared towards engaging you to support what you can and what you're capable of, because we believe you have something that you're capable of. And the world, or the way we are created, we complement each other. We don't compete with each other. Because everyone has a unique selling proposition. If I go to business, you have something that you own yourselves that you can do better. No one can do it. And another one has something else that they can do better. I cannot be a good comedian and MC like Arthur, but I have something else that I can do. And whatever I do and another one does is we complement each other very well and make sure that we complement and we don't compete. But that complementarity brings out something very good and a good blend. Competition is not bad, by the way, young people, but I'm focusing on complementarity. However, today I talked about a lot of opportunities that we have. However, today there are challenges that hinder your ability to optimally utilize your potential. These are a few to mention. Most of them, you've been mentioning them. The growing numbers of teen pregnancies, drug and alcohol abuse, probably we didn't have enough time to discuss about this. Human trafficking, probably we didn't talk about. All these are challenges that are at the doorstep that are waiting to trap the young people. School dropouts and many more. All these affect the promising youth, the promising future of a young person affected. This calls for collective teamwork to ensure all you young people are informed, empowered to make the right choices for your future. There's, I wish to reiterate Prenuptial Foundation's Triple E. I like it so much. Allow me Prenuptial Foundation to use this here. I like your triple E, which is educate, empower, and engage. If a young person is engaged or educated, you have the knowledge, you have the ideas, you have the information, and information is power. You remember everyone was talking about information, access to information. So if you're educated and you have information, that's the power. The second one is to empower you, give you platform, and we engage you. What do you think about it? What can you do? We cannot be everywhere, but when you're there, we are together. So the discussion, the topic today is about engaging the young people for global action. Young Rwandans have a legacy to live up to. You stand on the shoulders of the giants. There is a legacy that you cannot put on hold, that you have to carry forward. It is within your DNA, because you're standing on the shoulders of the giants that liberated this nation. In our nation's history, we saw the impact that young people had as a united front. Your choices or their choices, your choices right now can either be positive or negative and affect you individually as well as a nation at large. In a recent past, like I mentioned, 26 years ago, some of you were not born or were very young or small kids. Young people who had made poor choices were mobilized to kill, to destroy, and so they did. However, fortunately, on the other side, another group of young people in Murazizi, but which I can loosely translate or can say that resilience means resilient youth, which was a much smaller in size, but with a clear mission, with ideological clarity, with a justifiable cause, set out to end the killing and stop the genocide against Tutsi. We also know there are other groups of young people who took no action when they could do something, but stood on and watched. I want to quote one of the scientists, Albert Einstein, who quoted, "This is for you young people. The world will not be destroyed by those who do evil, but by those who watch them and do nothing." You are also an accomplice if you just keep quiet and look things. You see gender-based violence and you don't mention it, and yet you have a tool of social media. Everyone is a reporter with social media. You don't have to wait for media to be there. You have your tool and you are a reporter. You can report anything happening in your community, and I've seen it working for young people who are vigilant. I give examples of young volunteers in my community. They saw one of a car, the car that parked nearby. It parked there for 6 hours. I saw it. I did not say anything, but the young people were very vigilant. They kept on saying, "I see this car there for 6 hours. What is it doing?" That kind of second sense, that instinct that says, this must be not normal. The young people reported this, the youth volunteers, and they sent the message with the social media. "This car has been parked here for many hours. Can someone check?" The security came and checked, and there was nothing good about it. So they had to check. So everyone has a role, just even to report. You can change a lot of things. You can impact a lot of things. You can save a lot by using the tool that you have, every day you have, by reporting. Take a picture and send the message. You remember even this campaign that went on, I think that went viral when George in the US, when this hashtag came up, the Black Lives Matters. You remember that came from just a young person who took a picture of what was not right happening, and they sent everywhere and people reacted. If this young person was not there, this gentleman would have died and no one would know and nothing would come out of this. So that means we have a tool that we can use and we have the ability, all is within our hands. I call upon the young people in the world, and especially our young people in Rwanda, that we need more of you, young people, who take action and do what is right. I also call upon you today to use your energy, your knowledge, and the will for actions that impact your communities positively, that you take charge of your lives and create the future we want. We wish to applaud and appreciate again, like Mark said in the beginning, the young people in action, solving challenges, including providing solutions during this trying time when we're fighting COVID-19 pandemic. We have seen you doing a lot of work. You recall even the youth, Gumamurugo Youth Challenge, you are showing us what kind of sports you're doing, what kind of skill you have learned, how are you preventing your community, what kind of innovation you have developed. This is exciting. It shows that you can do something with the platform that we have. But also, I think we believe that an idle mind is the workshop of the devil. If you're not doing anything, of course, something bad will come out. People who take you in different bad things will come up. So every time, make sure you're engaged. You can do something. I think one of the speakers mentioned that redundancy is also a problem. Yet you cannot be redundant when there's a lot you can do in the community. Maybe your neighborhood is dirty. Maybe your neighborhood has a lot of grass. You need to cut it down with the young people in your neighborhood. Maybe there's something that you can communicate on social media, how to prevent COVID-19. Maybe you can even create a platform in this Gumamurugo Gahunda ya Nyobanyeshuri when the students are staying at home. Maybe you can even create a platform where you can help each other in science, in mathematics, in physics. Maybe you can grow mushroom in a small space in your community, in your home, where you can do something if you can create an conducive environment in your mind to make sure you're not redundant so that you cannot be used for any other bad things that can impact negatively on your lives and the lives of your community. Your nation has invested into ensuring you have good health. It has invested in education, has invested in health systems. We have security and a conducive environment. Now we look up to you. We might not have done it all. We might have some weaknesses and loopholes where we need to correct and make sure it happens. We cannot even say we have done enough. We still need to do much more. We need your innovation. So we look up to you to contribute in addressing challenges that young people and your communities face. I task you to think about how you can address these challenges. One, how do you address these challenges? First of all, research. Number one, research. You don't need a research paper that can be published. Do a minimal research and understand what is the problem in my own community and find ways to address them. Two, organize yourself with your peers and take action. You can find like-minded people and you do something together. Three, take advantage of the various services put at your disposal. For example, to mention but a few is iAccelerator that we have talked about. If you are an artist, at Rwanda Obuhanzi, if you are a business person, Youth Connect platforms that has created more than 8,000 jobs, and various services, including health services offered at youth centers, youth corners that you have mentioned, the youth platforms that provide voices for the young people, the National Youth Council, and many more that you can also come up, the Afrian and others that can come up. On social media, I have seen youth right now while we're celebrating International Youth Day today. Since 2000, that's when Rwanda started celebrating this. On social media, I'm so glad you can see youth in districts celebrating International Youth Day by participating in school construction. This is wonderful, bravo, excellent. They are doing what they can, giving service to the community, constructing schools for themselves, but also for their young brothers and sisters. I also invite you all to join us this afternoon. We're glad to join this webinar this morning, but also you have another session this afternoon that we organize with our partners and Imbuto Foundation and the National Youth Council. It's also going to be virtually celebrating International Youth Day with a theme that we try to craft and applaud the team that worked on it in Kinyarwanda. It's very excellent in English. We also try to look for something in Kinyarwanda. Njewe mukubaka ku Rwanda n'isi. My role in the development or developing my country and the nation and the world at large. Njewe mukubaka ku Rwanda n'isi. Uruhare rwanjye ni uruhe? So I really want to applaud this work that you have done. In conclusion, I wish to just our appreciation to our esteemed partners. KOICA, wonderful. Thank you very much. We've been working together a long journey of your support, your engagement, your involvement. We really appreciate KOICA's support, especially where we have, in addition to the partnership we've been having, the launch today of the KOICA 2020 Multilateral Cooperation Project, which is going to be implemented in the next 3 years. It's going to be impacting on young people It's really wonderful. We appreciate the UN family, where we have UNFPA, UNDP, UN Women, all partners along the way in the Joint Youth Program. We appreciate what you're doing. Thank you very much. Imbuto Foundation, we can't say much, but just to say, keep up the good job you're doing. We are also committed as a ministry that probably in the next celebration of 2021, we will be taking stock of what, from the discussion, what have we put into action? And we will be also being challenged by young people, and we'll also be challenging young people to see what can we scale up further in what we've done so far. Partners, we really appreciate what you're doing. As a ministry, your ministry stays committed to supporting young people, working with the various partners to address the National Strategy for Transformation 1 priorities. I thank you very much. I can't say it all, but I appreciate what you're doing and learned a lot, especially every day, make sure I learn something. I learned a lot from the young people. I thank you very much for your partnership, but also for your patience in listening to all this long speech. I thank you and wish you a happy International Youth Day. Have a good day. Thank you. Back to you, MC.
Thank you very much, Honorable Minister. And personally, I'm moved by the speech, especially when you go to the complimenting part and it's not a competition. Thank you very much for such kind words. And I'm pretty much sure we are all going to take it at heart. Now, the youth that is following us wherever you are, you got the message. You need to voice out your opinions. You need to get heard. You need to use all your platforms. Don't forget the fact that you are the one who can make the difference, and you are the future of this country, Rwanda, and the entire globe. Now, this is my takeaway message as the youth. Now, as the message to the partners and stakeholders, you need to ensure to engage and make youth participate in every single stage, from planning to implementation, including the community, national, and global level of the conversation. Thank you very much, Honorable Minister. Thank you very much, UNFPA Representative Mark Grant Schreiner. Thank you very much, Deputy Country Director of KOICA. Thank you very much to our partners, Ajahaldin from Imbuto Foundation. Thank you very much, the youth that is following. I can see all of you. I can't read all your messages, but I've been looking at your messages, the way you've been engaging. It's amazing. Thank you very much. Today has been a wonderful day. Remember to tweet this, use the hashtags. It's hashtag IYD2020, followed with hashtag IYD2020RDA. And now I'll just say this. My name is Arthur. I was the host of today. If we meet on the street, just say hi. Don't get close because of the period we are in. And just make sure you say hi, though, and say, hey, I saw you today. All right, then. Have a good day and enjoy the rest of the day. I would not finish by saying Happy International Youth Day to you all.
Thank you very much, Arthur. Thank you, Mark.
twose we tuzarwubaka.
nk'ubu ngubu hari abantu benshi twagenderaga mu kigare cyangwa tukagenda muri kirabaye urumva ariko muduhaye inyigisho nyinshi ku mpande zombi.
Kuri njyewe icyo nakora kugira ati ntibizambeho mu gihe kwifata byananiye nakoresha agakingirizo